and welcome back to another episode of Healthwise. If this is your first time, welcome. If not, welcome back. I am your host, Dr. Lescott, in collaboration with the St. Kitts Nevis Medical and Dental Association and the ZZ Corporation. We have an interesting topic for us to discuss tonight. I have here with me Nurse Jacinth Williams Fraser. I had to make sure I gave her full name, and Ms. Fraser is the community health nurse midwife.
Yes.
Okay, I'm making sure I said that right. And then I also have Nurse Naomi Brownbill. She's the nurse manager at the maternity unit at JNF, and also the Baby Friendly Hospital Initiative coordinator. I said that right?
Yes.
So welcome. So tonight our topic of discussion would be breastfeeding, a baby-friendly hospital initiative. And I have two persons here with me. I just introduced to you two nurses, top of their game, very much the expert on the topic. And I'm very pleased to have them here with us because I know lots of you out there. This is a topic that many persons I think will find beneficial out there in the community. So I would like to thank you guys for coming and sharing your expertise with us. So I'm going to open the floor with Nurse Fraser. You can tell us what the Baby Friendly Hospital Initiative is about and why it came about.
Good night, everyone. I'm going to tell you a little about World Breastfeeding Week, which starts from August 1st to 7th, 2024. World Breastfeeding Week is a global campaign to raise the awareness and provide education on breastfeeding and various themes. It's an initiative that began in 1992, so it's over 3 decades now. It is sponsored by WHO and UNICEF. The theme this year is Closing the Gap, Breastfeeding Support for All. What does breastfeeding support look like, you may ask? It's support from the dads. We are saying that the breast milk can be expressed and allow the dad to cup feed or spoon feed the baby. We are saying that that can give mom a massage, which relaxes her body and allows the breast milk to flow. That can also assist with household chores, duties, and with the other children. You have support from the workplace. Allow mothers an opportunity and the space to express their breast milk when necessary. This is important. If the mother does not empty her breast, it can cause breast engorgement, which is very painful, and it can also reduce the production of milk. To have support from health facilities. Mothers have the opportunity of returning to the maternity ward at any time if there is a challenge with a new baby, and they can visit their community health centers around the island, in St. Kitts or in Nevis.
Wow. So wait, before I'm going to put a thumbnail into that because we're going to dissect all of this information. So you're saying that if a mother is a young mom, she has a newborn baby and she's having complications breastfeeding, she can just go to one of the, is it the health center, or she can go
back to maternity ward,
and she will get guidance and assistance, and she will have persons to answer questions and to, I guess, soothe her concerns and make her less insecure?
Yes. And we also have a list of nurses. We have a card with a list of nurses who you can call at given times, whether it's via WhatsApp, via cell phone calls.
So it's a baby hotline?
Yes. We do have one. And you can call the nurses at any given time if you need support with breastfeeding. I personally am one of the nurses who are part of that team, and I personally have helped lots of mothers. I prefer to be called via WhatsApp video call.
Wow.
One of the reasons why I chose video call is because I actually like to see what
What's
the mother
happening.
is doing. Because sometimes it's just that they need a little bit more help with positioning the baby properly. Maybe it's how they have the baby latched to the breast, so the mouth is not open wide enough, or maybe it's just the mother position. She's not sitting comfortably enough. So
it's all of these mechanics that would make the breastfeeding experience productive or non-productive?
Yes. So that is something that we have started since maybe 2021, 2022.
I'm going to also put a thumbnail in the fact that you were encouraging fathers to get involved in the act. I don't think we hear that much. I want to expound on that again, because I can tell you so many mothers out there will probably want to shake your hand for bringing that to the forefront. So just doing things like giving her a back rub, rubbing her feet, making sure that the house is in order, making sure that the other children are in order, making sure that she also has something to eat after she has finished, because it makes you tired or famished. It makes you more hungry.
There's a hormone that is released when breastfeeding, and it relaxes you. So one of the things the mothers tend to do is feel sleepy, like they want to go to sleep. So having a father's support, sometimes the support is as simple as taking the baby and burping the baby for the mommy. That is a form of support as well. Just making her feel comfortable in the bed, helping her put up her feet as she breastfeed, helping her hold the baby and so forth, things like that. And one of the things I must say, and I think we don't say it enough, being a nurse on the maternity ward, I realize that the fathers are becoming more and more involved in their baby's life from the delivery room up until discharge. I can manfully say the fathers have been very supportive and have been coming and assisting with the babies. We have fathers changing diapers, birthing, interested in learning how to bath the baby.
Really?
Support. Yes. So I must commend the men of St. Kitts and Nevis for showing this great support, something that we have begin to get accustomed to seeing. So I must commend the men for that, because a lot of the time we forget that the men are a part of the process.
You have me smiling from ear to ear, and I'm really happy to hear good reports about the males in the community, because sometimes we hear so many bad things about men, and so I'm really happy to find that we have men that are stepping up, willing to be a part of the process and willing to be there for their children. And I really thank you for shedding a light on that, and for giving the fathers out there some much needed support, and to shine a light on the fact that, we're coming around as a society and things are changing. And I guess through initiatives like these, persons would become even more sensitized, and as the word gets out there, hopefully as time goes by, it's going to be a norm. So then if the mother can come today, the father can, he's free to come as well.
He's free to come to the antenatal clinics with the mommy. He's free to come to the doctor's appointments if he wants to. He's free to come to medical booking. He's free to be in the delivery room if he wants to as well.
Wow.
Yes.
That's awesome, because I remember back in the day we used to have complaints that the dads are not showing enough concern. I commend the dads out there for stepping up and for having a paradigm shift, and for seeing the importance of being present, because I'm sure just even that small support, no matter how small it is, it means a lot to the woman, because she's already going through changes, her body is transitioning. So we are not at a point anymore where we have a village, where we say it takes a village. Now we're more dependent on each other, like in terms of the family unit or a couple unit, because we don't have the wider community that we once had before. I didn't mean to interrupt.
No, it's okay, and that is why the team is so befitting for this year, closing the gap, breastfeeding support for all. So when we have the men involved, it really sheds support on the entire family.
I didn't even know that there was a breastfeeding awareness and a promotion all about it worldwide. We're going to take us a quick commercial break, and when we come back, we're going to discuss more widely this very interesting topic. Thank you.
Tell me a little bit about about your experience here shopping at Value Mart?
Well, I like to shop at Value Mart for a number of reasons. It's very convenient because I live just up the road. And another reason is that they have a huge variety of items. So, for example, you got, if you want almond milk, you have it in different brands. So, you know, they cater for everybody, each class when you look at income, you know, and the brands, different brands, a huge variety of different brands. And I also like the fact that you get to the points, the rewards. I love that. I look forward to coming to get my rewards. And yes, the customer service from the cashier is awesome.
Welcome back. For those of you, if this is your first time to Healthwise, welcome. And for those of you returning, welcome back. And we have a very interesting topic here for our discussion. It's breastfeeding, baby-friendly hospital initiative in commemoration of, is it Breastfeeding Awareness Day? Or week.
It's a week. It's an entire week.
It's an entire week of activities, and I would let my breastfeeding experts take over the floor again. So we have the discussion, the week of activity.
Okay, so as Nurse Fraser said before, the theme for this year's Breastfeeding Week is Closing the Gap, Breastfeeding Support for All. We celebrate Breastfeeding Week internationally, and it's from August 1st to August 7th. And this year, we are going to have a host of activities. We intend to take the entire month of August,
Wow.
although it's just 1 week. So we spread out our activities. So starting on August 1st, we'll have the opening of Breastfeeding Week by the Minister of Health. And from August 1st to August 31st, we'll have the airing of locally produced breastfeeding videos at St. Kitts and Nevis eateries. So all throughout the island, St. Kitts and Nevis, those eateries that have television that do advertisement, you will also be seeing videos regarding breastfeeding being advertised on those televisions. We also have videos will be showing at the ferry terminals in St. Kitts and Nevis and also at the Pelican Mall.
Wow.
On August 9th, we'll be having Stop and Chat, that's in St. Kitts, and we will be having nurses and members from the nutrition team will be in Bastia and also in Charlestown. They'll be interacting with the community and getting persons to tell us what they understand about breastfeeding, how they feel about breastfeeding, just for us to get a feel of what the community
I was just about to get to that. Like currently, what do you
breastfeeding.
think? Is it like something that persons are readily accepting of? Do people see breastfeeding as something important, currently speaking?
Currently, yes, because we have had breastfeeding stop and chats before. The last time we had it, I think it was on 4th Street.
How long ago was this? I've never heard of this, Stop and Chat.
2001, 2002.
No wonder, that's so long ago.
And we actually were stopping random persons, men, women, children, and we were asking them about breastfeeding, questions like how you position for breastfeeding.
You asked the man how to position for breastfeeding.
And ironically, the
They
men
knew?
actually knew and knew what the dark area of the breast is called, because that was one of the questions we asked, like if they're aware of what the dark area of the breast is called.
I don't even think
We
some
asked them
women
if
know
they
what the
different-
dark area is called.
Yes, and we asked them what the different positions can be used for breastfeeding. Some of them knew exactly what. We ask them questions like how long should a baby breastfeed for, if they ever heard of exclusive breastfeeding. These were just some of the questions we were asking, and we asked them to explain in their own words what they understand breastfeeding to be, what they understand exclusive breastfeeding to be, and so forth.
I'm surprised.
And it was very interesting to hear some of the
answers.
Yes, and the responses by persons in the community. So we look forward into doing this activity again. This will be on August 9th.
Would it be televised?
No, I don't think so.
I was looking forward to seeing what.
On August 12th in Nevis and on August 16th in St. Kitts, we have an activity that we do annually. We call it Thank a Nursing Mom, where we honor one mom from each health center. Throughout St. Kitts and Nevis, we have a total of 17 health centers. So 17 moms will be honored and receive a plaque with their name on it. And this plaque will be placed at the health centers for mothers who have done exclusive breastfeeding. When we say exclusive breastfeeding, we mean no other
similar
foods or water other than breast milk for the first 6 months of life. And yes, we do have mothers who give their babies just breast milk for the first 6 months. And so we use this activity as a means of encouraging mothers to continue the great job that they are doing, and we use them to encourage others to do the same.
So you become the breastfeeding champion?
Yes.
No,
I know that we said that we'll be using the entire month of August for breastfeeding, but we also stepping over into September, where we have September the 24th and 26th. We'll have Breastfeeding Friendly Initiative training, a 21-hour training course where we train our community nurses and hospital nurses, and also medical staff on breastfeeding. During this course, you will be taught how to breastfeed a baby correctly, what are the policy in regards to breastfeeding, the different positioning, how to help a mother breastfeed correctly, everything.
Awesome.
So this 21 hours. So that's an idea of what our breastfeeding week
And
of
I
activities
think you
will be
mentioned
like.
you guys will have a church service? No?
No,
Not
we
this
didn't have
time?
a church service around this time.
Okay.
One of the activities that we do sometimes is an antenatal workshop. And we're proud to say we had one earlier this year. And for the first time, fathers were present at this workshop, which was very good. And they showed keen interest in breastfeeding as well.
This is so interesting to me that the men are showing all of this interest and they're coming to the classes too.
Yes.
Wow. I wonder, what do you think caused this paradigm shift in the men's thinking? What do you think? When did it start? Like, when did you guys see an increase in the interest in the male population?
Well, I'm not really sure, but I think, everybody wants a healthy baby. And because we tend to preach this a lot, a breastfed baby is best fed baby. And everybody wants an opportunity to have a healthy baby. And sometimes the men are the ones who are actually encouraging the mothers to breastfeed, and they don't want the baby to get anything else other than breast milk.
Oh, so the men are upset?
Some of the men, yes. So you can actually hear some of the men telling the mothers, come breastfeed the baby ready to breastfeed.
So how does he know that the baby is ready to breastfeed?
Because there are signs, and we teach them signs,
yes.
we teach them cues.
Yes.
That they can identify these signs and know when the baby is ready to be fed.
Now, I know this is supposed to be a help to the mothers, but I'm sure this, having somebody telling you, but I really I like the initiative, and I like the fact that more men are becoming more sensitized and they're more on board and just all around more supportive, more helpful, and more sensitive to the entire process because they want to see a healthy baby. That's really awesome.
Yeah, and in talking to some of the men, you find that they never had a father figure in their lives. So it's an experience that they want to be in their children's lives. So they will tell you that up front as well.
Yes.
They don't want to have history repeating
Yes.
itself, so they're trying to break that generational curse.
Yes.
So I respect that, because it takes a lot of maturity for someone to realize that, okay, I don't want my child to go through what I went through.
Exactly.
And I really respect that. So we're going to take a quick commercial break again, and when we come back, we're going to have more juicy information for you guys in YouTube land. So we'll be back again shortly.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And thank you guys for coming back. If this is your first time to Healthwise, welcome, and if not, welcome back. So our topic of discussion this evening is breastfeeding, baby-friendly hospital initiative. I have with me Nurse Naomi Brownbill, who is the nurse manager of the maternity unit at JNF, and I also have Miss Nurse Jacinth Williams Fraser, the community health nurse midwife.
Yes.
Yes. So we're going to continue our very lively discussion on the topic. So, Ms. Fraser.
Okay, you may ask, why should you breastfeed your baby? Breast milk is readily available. You don't have to go to the shop to buy that. It comes straight from the mother's breast. It's at the right temperature in its own feeding device, which is the breast, so you don't have to boil any bottles or anything, and it's just ready for the baby to eat. Breast milk is free. No need to buy formulas, bottles, cleaning supplies for the bottles, etc. I'm not sure who have ever done the maths, but it's quite expensive to keep up with formulas for babies. When you go in Rams and the different supermarkets and you see the prices on these formulas, it's better to breastfeed.
Sounds more economically friendly and environmentally friendly too.
It is. Breastfeeding does not require, breastfeeding does require patience. You have to take your time with the baby. Make sure that the baby is properly latched to the breast and the areola, which is the brown area that we were talking about, and not just the nipple. Because the baby latched to the nipple, you're going to get sore nipples, and the baby will not be able to feed properly. So, latch the baby properly, and you will be able to have a successful, pain-free experience, and mommy and the family will be happy.
Okay, that's interesting. So you mentioned sometimes if the baby latches incorrectly, that could be a painful experience.
Very much so.
So I guess when they have the classes, you would explain how to avoid all of these, I guess, mistakes, you want to call them?
Yes, they are taught how to latch the baby properly at the hospital. I mean, they do come back to us in the health center, then we continue there, because remember we said that they can't go to any of the health centers and there are nurses who are on call to answer their questions. So yes, we teach a lot of proper latching.
But I have to ask though, just out of curiosity, the Baby Friendly Hospital Initiative, how and why did that come about? What was the reason?
Okay, so one of the purpose of having a baby-friendly hospital initiative is a way to make a healthier nation. Breastfeeding helps to reduce the incidence of persons becoming diabetics, having hypertensive, obesity, which can lead to a lot of other chronic diseases. So if you need a healthier nation, you have to start from birth, which is pregnancy, and then immediately after birth, which is breastfeeding. So in 2002, we had an assessment done for the hospital by PAHU, where they came in and they did an assessment of the hospital to see if we can be certified as baby friendly. Baby friendly means that you have passed the 10 steps to successful breastfeeding. And I just will mention a little bit about these 10 steps to give an idea of all the different areas that we had to pass. So the first step is have a written breastfeeding policy that is routinely communicated to all health care staff and parents. So we have a policy.
You can show them the book. This is it?
No, this is what we do for teaching. But we have a policy. I gave them the picture.
Can we have the picture of the policy so we can show the public? Here it is.
Not that one. The MAP policy. Okay, so we have a breastfeeding policy that is routinely communicated to all staff members, especially those of the maternity ward. And we also have a summary which we use for parents as well, because the parents also have to know of the policy. The other one was, the second step is train all healthcare staff in skills necessary to implement this policy.
So this policy can be viewed when they come to
Yes, we
JNF.
have it available
It's in a leaflet?
on the unit.
Okay.
It's at the maternity unit presently.
Okay.
And we have, this one is the one that we usually use for staff.
Okay.
And then we have a summary that we usually use for the parents.
That's awesome. This is really good.
So in training, part of the step of training is where we get the 21-hour training for staff. So we do a 21-hour training for staff, and we also do a short presentation for all other healthcare workers. Healthcare workers, such as even up to the maintenance,
Wow.
the landscaper,
Wow.
doctors, nurses, pharmacists. So we touch every single department, because one of the things when they're doing assessment, they can stop any worker at the hospital. You don't have to be a worker on the maternity unit. They can stop any worker, and you should be able to answer some of the questions that they ask. They have questions specific for immediate care persons and the persons who work on the auxiliary levels.
So then after this 21-hour course, is it a certification?
Yes, you get a certificate to say that you have completed the 21 hours.
So then how often do they conduct this training? Once a year?
We do it once every year. It's usually done around July, but this year we'll be doing it in September.
Okay, so registration, you have to register, or you're selected for doing that?
We usually start with the maternity staff, because when
Frontliners.
PAHU was coming for assessment, one of the criteria is that everyone who works on the maternity unit must have this 21-hour training. So when we started initially, we started with hospital staff and immediate community staff, but now we have extended it to like outpatient department, areas that will have encounters with babies and young children.
Gotcha.
So step 3, inform our pregnant women about the benefits and management of breastfeeding. Step 4, help mothers initiate breastfeeding within 1 hour of birth. And yes, that's something we practice. When you get a baby at the Jacinth Hospital or the Alexandria Hospital, one of the things that we do is the skin-to-skin process, where we place the baby on the mother's skin, and mother's naked skin to baby's naked skin, and we have the baby there for at least 90 minutes, which is an hour and a half. This says an hour, at least an hour, but we practice an hour and a half.
What is this supposed to do for the mother and the baby?
And this helps mommy not just to bond with the baby, but it helps to regulate the baby's temperature, and it helps the baby to be familiarized with the mother's natural flora, and the baby can also smell the breast milk.
The reason I'm asking is because, I mean, the breast milk and her flora is going to be there 3 hours and 5 hours later. So why is it so important for the first?
The earlier you start breastfeeding, the less likely of complications and difficulties with breastfeeding. So a baby who feed within the first hour of life is less likely to have problems with latching and suckling and so forth. So that's one of the reasons why we encourage that as well.
I understand.
There are instances where the mother might not be able to do this.
Yes, that's what I was thinking, especially if it's a long birthing process.
So what we usually do is, beforehand, we have the mother identify a person who she would like to do the skin-to-skin process if she is unavailable or if she's unable to do so. Most of the times, it's the father, the infant's father, the child's father.
Wow.
Or sometimes it might be a grandmother, it might be an aunt, sometimes it's her best friend, cousin, but most of the time we can say it's the child's father.
Just as long as it's some sort of skin-to-skin contact, it's better for...
Because remember I said that it helps to regulate
the temperature of the baby.
As well.
So you can't just put the baby in a blanket? I'm asking ignorant questions.
Yes, you can, but we don't want to. We
want it to be more human possible.
And have a connection.
Oh, okay. So as human as possible, the experience. I got you.
So step 5, show mothers how to breastfeed and maintain lactation even if they should be separated from their babies. And that's something we do. We know there are instances where complications might arise and mommy or baby might have to be separated for whatever medical reasons. And so, even though they are separated for whatever medical reason, we still assist the mothers with initiating lactation, whether it's expressing the breast milk and cup feeding, or we take the baby wherever the mommy is. We take the baby to the mommy, or we try to take the mommy to the baby. Like for instance, if the baby is in the neonatal unit for whatever reason, mom is allowed in there 24/7, however long she wants to.
Awesome.
Yes.
We're going to stick a thumbnail in that. We're going to take a quick commercial break, and we'll continue this discussion.
We never know when a storm may strike, but we can be prepared. At Scalec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. After the storm, our response teams will assess the damage to our network. If you are daring enough to go outside after the storm has passed, don't touch any downed power lines and stay clear of sparking wires. We'll need you to remain patient, as some restoration work may take longer than others. Before restoration work begins, we will fix any damage to our power plant and transmission lines. Then we'll restore power to priority areas, beginning with essential services like hospitals, police stations, and water pumps. After that, we'll restore power to the largest number of customers on one feeder, which will take the shortest amount of time. We will then restore power to smaller feeders and individual customers with isolated problems. Be sure not to worry. Scalec is right here with you when you need us most.
Tell me a little bit about your experience here shopping at Value Mart.
Well, I like to shop at Value Mart for a number of reasons. It's very convenient because I live just up the road. And another reason is that they have a huge variety of items. So, for example, you got, if you want almond milk, you have it in different brands. So, they cater for everybody, each class when you look at income, and the brands, different brands, a huge variety of different brands. And I also like the fact that you get to the points, the rewards. I love that. I look forward to coming to get my rewards. And yes, the customer service from the cashiers awesome.
To everyone in YouTube and TV or Radio Land, I have here with me two very, how should I say, experts in their field, nurses. I have with me Nurse Brownbill, Miss Naomi Brownbill, nurse manager of the JNF maternity unit, and I also have Nurse Jacinth Williams Fraser, who is the community health nurse midwife. And the topic for tonight we're covering is breastfeeding, the baby-friendly initiative hospital. Oh, sorry, I said that wrong. The baby-friendly hospital initiative. And we have, every year, there's an international awareness of breastfeeding.
Yes.
Okay. And so we'll continue our very riveting discussion with Nurse Brownbill.
So I was speaking about the 10 steps and the practices that we do at the Joseph and Faz General Hospital and the Alexandra Hospital in Nevis. So I move on to step 6. Give newborn infants no food or drink other than breast milk unless medically indicated. We know that there are medical reasons why we might need to give the baby something else other than breast milk. So in a case like this, it must be prescribed by the pediatrician.
A lot of people don't know babies are not supposed to even drink water. When you tell them, they're very much surprised that babies are not supposed to drink water.
So any other thing that we need to give the baby other than breast milk, it's the pediatrician who says how much to give and what to be given.
Okay.
We also, step 7 is rooming in. That's a practice we do.
What's that?
Rooming in means that the baby stays at the mother's bedside 24 hours a day unless medically indicated. So if there's nothing wrong with the baby, you have a nice, healthy baby, the baby stays at the bedside in a cot and rooms in with you, stays at your bedside all day, every day, unless there's something wrong with the baby.
And this would be for how long?
Until your entire stay.
This is during the hospital, so because I was thinking, yes. You mean when this child is at home? Okay.
But even at home, we want the baby to stay with you as much as possible. Just even at home.
I mean, I understand this, it's not like I'm totally ignorant, because even with the breastfeeding, studies have shown that infants who breastfeed as soon as possible after birth, they develop less symptoms of anxiety. Babies do have anxiety, and they do have separation anxiety. It's normal for them to have anxiety, separation anxiety, so I can understand why the rooming in is important. But I thought you would just have a baby monitor and, I don't know.
And not only that, but when you have a baby who is at the mother's bedside 24 hours a day, the mother tend to know her baby a little bit sooner and much more.
True.
Because she can see the different hunger cues more early. She can feed much better, and she can also have less difficulty with breastfeeding.
But I also need to put it out there that sometimes it's not automatic that the mother, it in everyday terms, it might sound that, okay, I gave birth to this baby, I carried it for 9 months, you would expect that the bonding is automatic. It's not always automatic. And I would like to put it out there for every mother, young or otherwise. You don't need to be hard on yourself. Like, I've known women to become anxious, nervous. They start thinking they're bad mothers because they don't develop that bond automatic. It's not automatic. It's really not. It takes time, as you said, to get to know your infant.
Yes. Step 8, encourage breastfeeding on demand. And on demand simply means whenever the baby needs it, however long the baby needs it for. So you don't put a time frame on it. You don't say, I just fed the baby an hour ago, the baby in hungry. So
you can't overfeed an infant with breast milk?
But it's less likely to overfeed when you're breastfeeding.
So the breastfeeding would regulate the appetites and what's not to, you mean?
Yes. Because once you learn the baby cues, the baby hunger cues, you can easily identify when the baby is full, when the baby is hungry, everything. When the baby is satisfied with breastfeeding.
I thought when they're satisfied, they just, what do you call this, delatch? Delatch, sorry.
Yes.
I've seen them, they just detach and they do this, they.
Step 9. Give no artificial teats or pacifiers, which we also call dummies, to babies who are breastfeeding. So one of our hospital policy is that no bottle nipples are allowed, no pacifiers are allowed. So if you come to the hospital, either hospital, whether it's Alexander Hospital or JNF Hospital, if you come with your pacifiers, we nicely tell you to please send them back home.
But then if the baby is already acclimatized to a soother, that means this child is going to scream all night, no?
The soothers, why we don't encourage soothers, there are complications when using soothers.
Yes.
Because the baby, when the baby suck on that soother, the stomach is getting filled with saliva. And the baby's stomach is very small, it's the size of a marble. So picture a marble and then all this saliva. By the time the baby is ready to breastfeed,
it's not going to feed.
It's not going to breastfeed much, and then you might wonder why your baby is not putting on the weight, and then you start to have concerns that your breast is not good enough, because that's some of the things we hear. The breast ain't good enough, the baby ain't putting on enough weight, so I need to give something else. But sometimes it's because you're introducing other things into the breastfeeding infant. So no pacifiers, no bottle nipples. Some persons might ask, what if I am a mother who have to feed baby something else other than breast milk? We teach you how to use cups, syringes, spoons for breastfeeding, because that is what we use. So before you leave hospital, you will be taught how to use those devices to feed your baby.
I got you. That's important.
And the final step, foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. So you see why we had to have the group formulated for breastfeeding support, because you must have breastfeeding support. If you're advocating breastfeeding, you must have a support system in place.
I got you.
So that's one of the reasons. And one of the things that we do is we utilize this book, Preparing for the Arrival of Your Baby, for delivery of your baby. Nevis also has a book similar to this one that they use. And these books from the minute you come to hospital or the minute you find out you're pregnant and you go to the health center, you receive one of these books, and these books takes you right down until you have your 6 weeks postnatal visit.
Wow.
It tells you what to expect when you come to the hospital, what to expect when you go into labor, what to expect when you are in the delivery room, what to expect right after delivery, what to expect when you go for your 6 weeks examination.
Wow, so they just tell you all of the expectations.
Yes.
I think I like that. So no mother, once they're under the system of the hospital right now, should be left behind. Everybody should basically be on the same page, and the infants themselves should be very much benefiting from initiatives like this, because then it means that our infants are getting their proper nutrition, their immunity is up, and they're going to be meeting all their milestones, and they're going to be putting on the weight that they need to be putting on at the appointed time, which is important for infants. So going to move right into a breastfeeding PSA. Okay.
I am so frustrated. Junior wants to eat all of the time.
It has to be he's hungry. I don't think you have enough milk. I could hear this poor baby cry from my bedroom. Let's just give him a pacifier to calm him, and in the morning I will go and buy a formula. That will satisfy him longer than breast milk.
I was taught at the antenatal clinic that breast milk is best, and pacifier and other feeding nipples or teats can confuse the baby.
I don't think that you will be able to breastfeed effectively, so formula is just as good.
I don't think I have enough milk. The baby wants to eat all of the time.
How often do you breastfeed baby?
I read online to wake the baby every 3 hours to breastfeed.
Feed your baby whenever he shows feeding cues and feed him as long as he wants to feed. Plenty of wet and dirty diapers and consistent weight gain are signs of adequate feeding. Let me observe how you breastfeed the baby. Yes, I can see that the baby has a good latch and is positioned well. Continue to follow your baby's cues and nurse him whenever he wants to nurse, okay? Babies eat often.
Once you're done feeding, I can hold him on my chest so that we can do skin to skin and you can take some rest.
That sounds right. He's doing very well and you are taking good care of him. Feed him when he is hungry and the baby will stop when it's full. As he gets older and his tummy gets larger, the frequency of feedings will change. But as long as you are following his cues, he will be fine. The breast milk you are giving to him is the best for him. As well as nourishing him, breast milk protects your baby. Breast milk is full of live ingredients such as white blood cells and beneficial bacteria, as well as other components such as antibodies, enzymes, and hormones, which all fight infection, prevent disease, and contribute to normal, healthy development. Babies who are breastfed exclusively for their first 6 months are less likely to suffer from diarrhea and sickness, gastroenteritis, colds and flu, ear and chest infections, and thrush. Give baby breast milk only, no additional food or drink, not even water, for their first 6 months of life. When he gets closer to 6 months, he will probably be ready to try some new flavors and textures with complementary foods. I have a handout here for infant feeding from birth to 6 months. You can see the recommendations, feeding cues, and relaxation techniques like we discussed earlier.
I think it makes sense. I'm glad I don't need to give him formula.
Absolutely. Breast milk is best. Would you like to take this handout with you?
Sure.
That would be wonderful. I'm going to put that into your record. What else you will need to meet your goal of breastfeeding?
I am fine for now.
That's great. Be sure and let us know if you have any problems. As for future appointments, we will need to weigh and measure your son again at his next scheduled appointment. Your next appointment will be in 1 month. What other questions do you have?
Nothing else.
I'll make a note on your card about the next appointment. I know you will be able to continue successful breastfeeding. Thank you so much for coming in today. It was nice to see all of you.
Thanks.
I am so happy that you are breastfeeding my grandchild. It is sometimes challenging to breastfeed at the beginning, but we are here to support you. I see that the baby is feeding normally, just like the pamphlet that the nurse gave us says.
We never know when a storm may strike, but we can be prepared. At Scalec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. We monitor the storm and work closely with the authorities. We'll need you to ensure that there are no trees in the lines near you. If you need our help, call us for more information. It is likely that there will be a power outage, so make sure all your devices are fully charged. If you have a generator, make sure the changeover switch works. Ensure you have enough fuel and that your generator is isolated from the grid. It's best that you power off your main switch from the electrical panel and unplug all appliances. When calling to report faults, Tell us everything. Don't leave any information out. After the storm, our response teams will assess the damage to our network. Be sure not to worry. Skelec is right here with you when you need us most.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para cortar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And welcome back, guys. If this is your first time to Healthwise, welcome. And if not, welcome back. Our topic for this evening would have been breastfeeding, the baby-friendly hospital initiative. And I have my two leading experts side by side me on the topic. Nurse Brownbill, Nurse Manager of Maternity Unit, Jacinth, and Nurse Fraser, the community health nurse. So we're just going to continue on the topic. Before we left for commercial break, we're going to elaborate.
Okay. Earlier I was speaking about the policy that is communicated to all staff and parents, and I just wanted to say that we have the full support of the federal cabinet because these policies were approved by cabinet. Yes.
Wow.
And these policies covers all 10 steps to successful breastfeeding and also supports mothers who cannot breastfeed, whether it's through medical illnesses. He also supports that as well.
You know, at first when you told me that when you told me that they had a policy initiative that went to the house, I thought you were going to make it illegal for mothers not to breastfeed and you're going to get a fine or go to jail if you don't breastfeed your child. But I'm happy it's because we are trying to basically improve the health and nutrition of the mother. Nurse Fraser was telling me that there are benefits also to the mother from breastfeeding. I've never heard of the benefits to the mother. I've always heard of the benefits to the child. So what are the benefits of breastfeeding for the mother?
There are lots of benefits for the mother, but just to name a few. For the mother who breastfeeds, she have a less risk of breast cancer, ovarian cancers, and endometrial cancers. Breastfeeding, all diabetic mothers, they require less insulin when they are breastfeeding. It reduces the risk of metabolic syndrome and it reduces the risk of postpartum bleeding. Breastfeeding helps you to lose weight. It also serves as a birth control method where your menses, for some people their menses doesn't come back right away. Sometimes it takes up to a year. So it helps in that. It helps your iron content to build up because you're not having the bleeding. Then it helps to improve the iron content. So there's lots and lots of benefits, not only for the mother but for the family. It's less expensive, readily available, and all of that. So you have lots of benefits.
To save money to do other things in the house.
I never thought about it like that, and I didn't realize that breastfeeding would have been the thing that would prevent these different sorts of cancers. I don't think persons know of this. I don't think it's something that you hear spoken about too often. This is the first time I'm actually hearing about that. So I thank you for bringing that to light. And in terms of helping you lose weight, I've known of persons telling me that breastfeeding helps to set your organs back into place after birth. Is there any truth to that?
Yes.
Because as you know, when you get pregnant, the womb, as your tummy grows, it's going to push all of your organs out of place to facilitate the growth of the tummy. So the breastfeeding action, what I was told, it helps to set your organs better back into place than if...
Because it causes contraction, and with the contraction, your organs, your womb goes back down to its normal shape, its normal position, so the other organs can be laid back out properly, just to how it was before pregnancy.
Wow, that's interesting. So it's really beneficial to the mothers, as you were saying. So just to wrap up, can we have the baby feeding cues? Can we go over those so that we can shed some light?
So all mothers at the Alexandra Hospital and JNF Hospital are taught how to identify when your baby is hungry. So remember, we are teaching them feeding on demand, because that is one of the 10 steps, feeding the baby on demand.
So to know if you're hungry, your child won't just cry?
That's the last sign. Most of the parents look for that last sign, but crying is a sign that the baby is agitated.
And shouldn't vex.
Because the baby would have already showed you the early cues, the mid cues,
and we missed
now
it.
Has moved on to the late cues. And it's late cues is telling you, I'm upset, I've shown you all the other signs,
and now I'm angry,
that I'm hungry, and you have been ignoring me, so now I'm upset. All right?
And now to wake up the whole house because I want my food.
Yes, so we teach our mothers to identify the early cues and the mid cues before identifying the late cues. When the baby reaches to the late cues, the baby is already agitated and fussy, so you actually have to take time now to soothe the baby.
So if you put the titty in the mouth, it's going to soothe?
It's not going to breastfeed, it's not going to suckle, and if the baby do attach to the breast, might not attach properly because you're going to be frustrated and moving all about and angry, right? So we don't want that. We don't want you to have difficulties with breastfeeding. We want breastfeeding to be as comfortable as possible, so we encourage our mothers to feed the baby before the baby actually start to cry.
So she basically has to be sitting down there and watching this baby in the crib?
Not necessarily. You can do your household work just like you normally do. You can sleep when the baby is sleeping. If you miss the other cues, the baby will wake you. Because there are times when you might be sleeping and you might only identify the crying cues. But then you don't want baby to cry to the point where the baby is actually changing colors.
Oh dear.
Because that is real agitation. Okay? So you don't, although the baby might cry, you don't want it to reach to that kind of crying.
You guys, this topic tonight, we can go on and on forever. I would like to thank you guys for coming on out and for sharing all of this wealth of information. And just to wrap up, this is a week of activities. Is going to begin when?
From the 1st of August to the 7th of August is International World Breastfeeding Week. But we will be celebrating from the 1st of August to the 31st of August.
That's awesome. So it's been a pleasure having you guys on the show. I learned a lot, as I said. And don't hesitate to come back. Nurse Fraser, Nurse Brownbill, don't be a stranger. You guys are always welcome on the Healthwise show. And thank you. And for everyone who joined us in YouTube and TV land, thank you guys. And I'll see you again in the next episode.